Dr. Nicholas Jones, Nip and Tuck Plastic Surgery. And recently, my team posted on Instagram, and we had a lot of comments regarding patients' age and plastic surgery. So what I want to do today is sort of demystify age in plastic surgery. For me, when I'm doing a surgery, the first thing I want to make sure is that it's safe for a patient to undergo surgery. And so when it comes to age, I think one of the oldest patients I've operated on was about 78 years old, and she underwent abdominoplasty with lipo 360. And I had no hesitation to perform her surgery because of her overall health status. So when I'm assessing a patient, first thing I want to know is, can I meet their expectations? Like, what is your problem? What do you want done about it? And can I realistically do what you want? Once we've established that, then I need to know, is it safe? So what type of things come into account? What am I looking at? How am I weighing the risks? So first and foremost, we want to get an adequate medical history. Do you have any underlying medical conditions? And how will those underlying medical conditions affect your ability to undergo surgery? So hypertension, diabetes, a history of a pulmonary embolism. If you've had general anesthesia before and they had to stop your surgery, of course I want to know why they had to stop your surgery. Do you take your blood pressure medication? What's your hemoglobin A1C? All of these things are taken into account, even your allergies to medications, because once you're in this operating room, the anesthesiologist puts you to sleep, they have to control your blood pressure, your heart rate, your oxygenation. All these things are very important. And so to better manage your care, we need as much information as we can possibly get so that I can make an informative decision on your behalf and do what's safe for you. The amount of time that the case is going to take. You may not be able to withstand a 7-hour operation, so maybe it needs to be broken up, or maybe you're not a candidate at all. And so all those things are taken into account. Patients who take blood thinners. Why do you take blood thinners? Oh, well, doc, I had a blockage in my heart, and they told me I had to take it the rest of my life. Well, you may not be a candidate for outpatient surgery, or you may not be a candidate for surgery at all.
No. Wait.
So again, as a patient, it's very important for you to be forthcoming and completely honest with your surgeon. And as a surgeon, like I said, we can make a best decision. Other thing I take into account is, will you heal after surgery? So what type of things may affect your body's ability to heal? Smoking, that's an absolute no-no. Illegal drug use can affect how the anesthetics work in your body. You may have a prolonged recovery. So in short, there is no age limit. It's more about your overall health and a planned procedure and whether or not it can be done safely.